So hello everyone and welcome to the 20th case of this case discussion series. So today we'll be discussing an MRI case. So here we have a 59-year-old obese female who presented with postmenopausal bleeding since 1 month, and MRI pelvis was done for this patient, and these are the SAG T2 weighted images of the MRI pelvis of the patient. The bladder is empty and there is diffuse thickening of the endometrium which appears heterogeneous, and there is loss of the junctional zone. It is predominantly hyperintense to the myometrium. The cervical stroma is preserved. These are the coronal sections where we can see that the T2 hypointense fibromuscular stroma of the cervix is preserved. These are the axial sections where we can see that the endometrium is irregularly thickened with indistinct junctional zone, more so on the posterior side. These are the STIR images. Post-contrast images could not be done for this patient because of the deranged RFT. Here we can again see the altered signal intensity of the endometrium. So this is the report that I had given, that the uterus was normal in size with normal contour. Diffuse irregularly thickened endometrium measuring 24.7 mm and appearing heterogeneous with altered signal intensity on all the sequences shown. Was suggestive of again neoplastic etiology, and it appeared predominantly hyperintense to the myometrium on T2 and isointense on T1 with indistinct endometrial myometrial junctional zone, more so on the posterior side than on the anterior side, which suggested myometrial invasion and indicative of endometrial carcinoma. More than 50% of the myometrium is actually involved in this particular case, as calculated by Gordon's method, which I'll be showing in my next slide. And the cervical fibromuscular stroma, which was seen very well, was homogeneously hypointense on T2 weighted images with no obvious invasion. The uterine serosa and adnexa were all clear. There were no obvious pelvic lymph nodes which were present. So features were suggestive of a diffuse endometrial neoplasm, likely type 2 endometrial carcinoma, FIGO stage 1B, and HPE correlation was advised. So these are the FIGO staging of endometrial carcinoma, and this is the Gordon's method of calculating the myometrial invasion, where the entire myometrium is taken, the thickness of the entire myometrium is taken, and the thickness of the invasion of the endometrial carcinoma into the myometrium is taken, and they both are divided to actually get the percentage involvement of the myometrium. If the percentage is less than 50%, it is 1A. If it is more than 50%, it is 1B. But in both the cases of stage 1, the tumor is confined to the uterus. In stage 2, there is cervical stromal invasion. But in this case, the fibromuscular stroma was homogeneously T2 hypointense with no invasion. Stage 3A is invasion of the serosa or the adnexa. Stage 3B is vagina or parametrial involvement. 3C1 is pelvic node involvement, which was not present in this case. 3C2 is para-aortic involvement. And 4A is invasion into the bladder or the bowel mucosa. And 4B is distant mets, including the abdominal mets or inguinal lymph nodes. So coming to type 1 and type 2 types of endometrial carcinoma, type 1 is usually seen in unopposed estrogen state, which is more common, and the precursor lesion is atypical hyperplasia. It is usually seen in obese female. That is why I mentioned in the history that she was an obese female and there was atypical hyperplasia that was present. It is endometrioid type of histology and usually has a indolent behavior with metastasis to the adnexa and serosa, while type 2 usually metastasizes to the peritoneum and is very aggressive, and the myometrial invasion is also very deep. Type 1 occurs at a younger age group than type 2 endometrial carcinoma. And type 2 endometrial carcinoma, the precursor is not hyperplasia, rather it is endometrial intraepithelial carcinoma. So this is a YouTube video that I have on gynecological malignancy stagings, where I have discussed about endometrial carcinoma, cervical carcinoma, as well as ovarian carcinoma and their staging systems. Kindly go through it.